Assalamu alaikum. My name is Dr. Muhammad Awaz and I am consultant pediatrician and assistant professor in pediatrics. Today we will talk about the second part of the history in pediatrics. We have talked about in first part regarding rapport development, presenting complaints, history of present illness, and systemic inquiry, and we have talked about the past history. The next component is the pediatric history, which includes birth history, vaccination history, even nutritional history, and developmental history. So in birth history, we start from antenatal history and we ask about mother, uh, was she booked during the antenatal period, and some obstetrician has checked the mother for blood pressure and sugar and pallor or anemia during pregnancy, and mother has been advised some supplements, multivitamins or iron during the pregnancy, and has there been any scans during the pregnancy, ultrasound scans, especially the 18-week scan and anomaly scan, or is there any history of recurrent fever, UTIs, etc.? Has mother been given two steroid shots during the pregnancy for fetal lung maturity? We are working in Pakistan, so we need to ask about the vaccination status regarding the tetanus vaccination of the mother during pregnancy. Then we will ask about the perinatal history or natal history, in which we will ask about the history of premature rupture of membranes, how much it was prolonged, and was there any history of fever, and was mother given antibiotics in this case, and along with maternal fever, was there any fetal tachycardia on the CTG or any bradycardia on the CTG, and what was the mode of delivery? Was that normal vaginal delivery or cesarean section? If there is cesarean section, was that elective cesarean section or emergency cesarean section? And what was the indication of cesarean section? And was baby cried spontaneously after the birth, or baby needed some stimulation? How much stimulation, or how any other intervention required at the time of birth? Was postnatal, was there in postnatal history we ask about, was there any admission for the baby due to some feeding problems or some jaundice at the time of birth? If there was jaundice time of birth or afterwards, was baby given phototherapy or any exchange transfusion was required at that time? Was there any history of fever or fits in baby? And if it was there, was any lumbar puncture done or not? If some CSF examination has done, what was the outcome of the examination? And there's so many other things we can ask. And then we'll come about the vaccination history, which is in Pakistan, the vaccination schedule, immunization schedule, is EPS schedule. EPS stands for extended program of immunization. So we should know about the vaccination types at different certain age groups. For that we need to know the EPS schedule, and then we need to ask about the nutritional history. So for nutritional history, we'll ask about the breastfeeding, for how long the baby was breastfed, and when weaning was started. At the WHO recommends weaning at 6 months of age, and was that weaning appropriate or not? And we can ask about the calories. We can assess about the calories by asking the type of food mother is giving to the baby, and are that calories appropriate for the age and weight of the child? And in our setup in Pakistan, we need to ask for any cow's milk mother is giving, If cow's milk she is giving, sometimes they dilute with water, or with 1:1 dilution and over dilution as well. So we need to ask about the same. So because this is one of the major causes of malnutrition in our country as well. So these are the nutritional aspect, and then we'll talk about developmental history. For developmental history, you need to ask about the hearing and vision of the child from the mother. We need to cover especially the four major domains. The first is the gross motor, then fine motor, then speech and language, and then social. So for example, in gross motor, we ask about the neck holding at 3 months, sitting at 6 months, standing with support at 9 months, and walking independently in between 1 year to 1.5 year. And like in fine motor, we ask about the fix and following, and in social, we ask about social smile or stranger anxiety. So at certain ages, so we need to know about the developmental norms at appropriate ages. So for this, we need to uh, have a look on the developmental charts, and we need to memorize them as well, especially the major milestones we need to know, so that we can ask certain questions in the history. Now, after the developmental history, we talk about family history. Especially family history, we ask about the cousin marriage of the parents, and how many siblings are there, how many male and female, any his sibling with the similar kind of illness, death of any sibling, and what was the cause of death of the sibling, and any chronic disease in the family. Then we come to the socioeconomic history. In socioeconomic history, we ask about social conflicts within the family, any cigarette smoking in the family, any economic wise, who is earning, and how many dependents are there. Father most of the time is earning in our setup, and what are the daily wages for the father, or per month income, and how many people are there for, he is looking after, how many dependents are there, and how big is the house, in one room how many people are living, residing, and what is the hygienic condition, what is the sanitary condition, which water they are drinking for, and these things we need to ask in socio-economic history. Also, one thing is left, drug history or allergy history. In drug history, we ask about any medication for a prolonged period of time, and any drug causing any allergy or any other allergy, like pollen allergy, pollens, or any dust allergy, etc. We have talked about school history. We can ask in the end about schooling as well, if we have not asked about the schooling before, in case of elder kids. And I think these are most of the aspects of the history we have covered. And if you have any question, you can ask in the comment section. Thank you very much.